Welcome students to another session of biochemical test, that is urease or urea hydrolysis test. It is an important biochemical test used for identification of microorganisms, mainly gram-negative bacilli, in the Clinical Microbiology Laboratory. In this session, we will learn its principle, media used, procedure, interpretation, important organisms, clinical importance, and Viva questions. What is the clinical importance of urease test? It helps in identification of organisms such as Proteus species, Helicobacter pylori, Cryptococcus neoformans, especially in the clinical condition like urinary tract infections, gastric infections like peptic ulcer disease, then fungal infections. What is the principle of urease test? It is mainly based on the ability of the organism to produce urease enzyme. So here the urease enzyme present in the bacteria mainly breaks down the urea to ammonia and carbon dioxide. This ammonia is mainly responsible for increase the pH of the media and making it alkaline. Phenol red indicator changes the color of the media from yellow to pink in alkaline pH. So pink color indicates positive urease test. So here an important point is that here the phenol red is used as the pH indicator, which is at pH 6.8 it is colorless, and when the pH increases to 7.2 the color of the media turns to pink. What is the purpose of this test? It is mainly used to identify Proteus species from other members of Enterobacteriaceae family. So here are an example of the some Proteus species which show the urease test positive, which are first Proteus mirabilis, Proteus mixofaciens, then Proteus penneri, Proteus vulgaris. Urease negative Proteus example is Proteus inconstans. Providencia shows variable urease reactions. Then Morganella morgani biogroups 1 and 2 show urease weakly positive. It also helps in to differentiate Klebsiella oxytoca, which shows positive reaction, and Klebsiella pneumoniae, subspecies pneumoniae, also shows positive reaction from other Klebsiella species, which mainly shows negative reactions. Bartonella fellis, which shows positive reaction and distinguishes from other species of Bartonella which shows negative reactions. Bordetella avium, which is negative, but Bordetella pertussis and Parapertussis which shows positive urease reactions. Next, Mycoplasma urealyticum is the only Mycoplasma strain which shows positive urease test. Some important Viva questions. Urease test is the only test among few biochemical tests used to detect both the bacteria and fungus. It mainly helps in the identification of Vibrio parahemolyticus, Helicobacter pylori, Mycobacterium species, and few fungus like Cryptococcus species which shows positive reactions, and Trichophyte or Mentagrophyte also shows positive reactions. Two important media are used for urease test. First is the Stewart's urea broth, which is a liquid media, and Christensen's urea agar, which is the solid media. Both media contains urea and phenol red mainly acts as the pH indicator. Christensen's urea agar, this is the most commonly used in all microbiology laboratory. Heavy inoculum is needed on the entire surface of the slope of the media. Do not stab the butt. The optimal pH for urease activity is 7. The reagent is phenol red, which acts as the pH indicator, as I have told earlier. Your acidic pH, the phenol red indicator is mainly yellow in color, and in alkaline pH it turns to pink color. Procedure of the test. First, the colony is taken from the nutrient agar plate, then it is inoculated in the Christensen's urea agar on the entire surface of the slope. Then heavy inoculum is mainly needed. Then incubate at 37 degrees centigrade for 24 to 48 hours. and after 48 hours observe the reaction of the test. Most important parts during the procedure. Prepare the basal media without adding glucose and urea. pH should be maintained at 6.8 to 6.9. Sterilize the media by autoclaving, then add glucose and urea by filtration method. Urease activity is observed better at 7.1 pH. Heavy inoculation is needed on the entire slope. Incubate the tube at 37 degrees centigrade for 24 to 48 hours. Urease test negative reports should not be given until after 4 days of incubation because some microorganisms are slow urease producers. Here is the interpretation of the test. If the media color changes to pink color, then it indicates positive reaction. If it remains as such or yellow in color, then it indicates negative reactions. Here are some important urease positive organisms. So first, rapid urease positive organisms are Proteus mirabilis, Proteus vulgaris, Morganella morgani, Helicobacter pylori. And slow urease positive organisms are Klebsiella pneumoniae, Cytobacter fruendi, Yersinia enterocolitica, some strains of Staphylococci. Urease test is not consistent among bacteria. Remember, some enteric bacteria are strongly urease positive like Proteus species. Weakly positive organisms are Klebsiella pneumoniae or negative reaction is mainly shown by Escherichia coli. Because of this reaction overlaps among organisms, it causes difficulties during interpretation of organisms. Therefore, interpretation should always be correlated with other biochemical tests. Clinical importance of urease test. So let us see the clinical case scenario. A 45-year-old male presented to medicine OPD with chief complaints of burning micturition, fever, lower abdominal pain since 15 days. The urine sample is sent to microbiology laboratory. So laboratory diagnosis. First, urine culture showed swarming growth on the blood agar plate and non-lactose fermenting growth on the clade agar. And on urease test, it shows positive urease reactions. So the causative organism is Proteus species. Let us discuss some important questions. Why does Proteus infection cause renal stones? Because urease enzyme present in the bacteria splits urea into ammonia, increases the pH of the media, promoting struvite stone formation. Look at the next clinical scenario. A 35-year-old patient has epigastric pain, gastritis, history of recurrent peptic ulcer since 1 month. Endoscopic biopsy is subjected to rapid urease test. Positive urease test suggests presence of Helicobacter pylori. So next question is, what is rapid urease test? It is mainly used to detect Helicobacter pylori infection in gastric biopsy sample, which is mainly obtained by the procedure of endoscopy, which suggests diagnosis of peptic ulcer disease. So here, the rapid urease test is mainly available in the market in the ICT kit format used to detect H. pylori infection from the gastric biopsy sample. Let us discuss some precautions during urease test. If you use Stewart's urea broth, then urease activity is observed after 48 hours of incubation because ammonia is produced and cannot be neutralized by high buffer nature of the media. It is mainly useful for Proteus species. In case of some bacteria like Enterobacter species, it can attack urea slowly and Stewart's urea broth is not suitable media to detect urease activity within 48 hours. Important points for laboratory technicians. Do not heat or reheat urea base into solution. Urea decomposes on heating. Due to autohydrolysis nature of the media, it is advisable to store the media in refrigerator at 4 to 8 degrees centigrade. Some bacteria like Pseudomonas aeruginosa utilizes peptone present on slant agar and causes hydrolysis of peptone, which leads to alkaline pH and ultimately gives false positive result. So always use control media, that is same basal media without urea. So students, this was the complete discussion on urease test or urea hydrolysis test in Clinical Microbiology Laboratory. Please like the video, share it with your friends and subscribe to the channel for more microbiology session. Thank you.